Hey guys, Dr. Wayne here from HealthFit Physical Therapy and Chiropractic, and I want to talk to you guys about chronic low back pain today. With chronic low back pain, as a clinician and as a patient, I think it's very important for us to understand why it happens and what are some things to look out for. So when chronic low back pain happens, usually it's pain that has lasted anywhere from 8 to 12 weeks or even longer. Very commonly, we get most patients that come in with chronic low back pain that has lasted for months to years. And they just haven't done anything about it, whether they've gone to other services, other physical therapy clinics, and just didn't get what they needed. And I think the biggest thing that we always mention to our patients when they come in is that going through rehab, the most important thing to know is that you will have some sort of flare-up. Be prepared for that. I think if we put that premise out there for patients first, if there happens to be a flare-up, they tend to take it a little better because then they can remind themselves like, hey, when I do have this flare-up, Dr. Wayne or whichever clinician you're working with has already mentioned that, and it is normal. One thing we also mentioned too is also building a bigger cup for you, a bigger plate. And I like to use that analogy because we're always trying to build resilience within our patients. We want to make sure that they are stronger than before they came in for anything. And we want to make sure that if once we discharge them and they go out and do whatever their goals are, whether it's like skiing, playing basketball, lifting again, want to make sure that they have a really big foundation so that when they do go and do the things, they don't get hurt again. Another thing we really want to understand is that not everything is rainbows and unicorns when it comes to therapy, right? But especially when we go back to the flare-ups. There'll be days when you have, no pain. There'll be days when you do something and, you get flared up again. But a really good important point is to really take a look back at your recent flare-ups or your past flare-ups, and were they just as bad, or was this just bad in the past few days where you felt really, really good? And understanding that there's also physical pain that comes with chronic back pain, and then there's also the psychological and neurological effect of chronic back pain. So the physical stuff is also really trying to build resilience within the muscle tissue, understanding that, hey, like if you're gonna do an activity, we have to build not just the back muscles, but also everything else around it so that you can tolerate movement, right? It's not just bending forward, but it's also twisting, it's power movement, it's dynamic movement. Make sure that we move as a human being rather than just moving in one plane. Now, the mental aspect and the neurological aspect, that's something I really like to get into. And I talk to my patients about, stress management, meditation, breathing exercises, and really understanding like, hey, look, even though you say you're not stressed, the world we live in is stressful. So I always teach my patients some diaphragmatic breathing, maybe some box breathing, things that kind of calm down the nervous system, get them away from a very sympathetic state or a fight or flight nervous system, and bring them back down to a parasympathetic state or a rest and digest nervous system. That really helps with the sensitivity of pain, helps with their blood pressure, helps with the cortisol levels, helps with sleep as well. So those are kind of some of the things that I want you guys as potential patients or even as clinicians hearing this is to understand that all that stuff is normal, but understand that you also need to create a plan of care to build resilience within your patient. As a physical therapist and our chiropractors here as well is to understand that the person you're working with is also your coach. And also talking to you about, hey, how do I get through certain obstacles? How do I plan for certain goals? And then you go through that, not just as a physical coach to kind of get you out of rehab and, get out of pain, but also a mental coach to really put you in the right mindset to heal. So if you guys have any questions on chronic low back pain, would like to hear anything else from us here at HealthFit, please drop a comment down below and we'll see you guys next time. Peace.